appreciate the call. Let's go to Ari, who's calling from the Rothman Institute. He's the doctor at the Rothman Institute, so he can shed some medical information on this marijuana use. Ari, how you doing?
I'm well. How are you?
Good.
Yeah, it's great that you guys are bringing this up. I think it's a hot topic, and it's encouraging to see that the NFL is opening their eyes to alternatives to opioids for treating chronic pain. And I just wanted to share a little bit of my experience and answer any questions you guys had, because there's definitely some, misinformation being shared around the country about medical marijuana. I've certified over 500 patients in my practice at Rothman Orthopaedics, and so I have some experience with it. And one thing I think that people don't realize is that, there's a big distinction between medical marijuana and recreational use of marijuana.
Mm-hmm.
And there are actually non-intoxicating products for sale in states that can provide symptom relief without the intoxication or high, and allow people to function at a normal level and again, return to play.
What's available in Pennsylvania and New Jersey without, you would need a doctor's prescription, right? You just can't get...
Correct. You need to have a qualifying medical condition, and every state does it differently. So Pennsylvania is actually very different than New Jersey. But in Pennsylvania, there are 21 medical conditions that qualify for access to medical marijuana, and chronic pain is one of those conditions.
Mm-hmm.
And in Pennsylvania, we don't recommend smoking it, so it's not legal to smoke, but you can vaporize or inhale the vapor of the plant or oil that's a little bit gentler on the lungs. And there are also oral products and topical products that again, at the right dosage, can provide some symptom relief without the common side effects that some people get from smoking marijuana.
All right, let me ask you this. Would you rather prescribe for pain management medical marijuana or opioids at this point of your career?
I'd much rather prescribe medical marijuana in the right setting. And I think we have to take into consideration the fact that with any drug, there are at-risk populations. There are people that should avoid marijuana, especially if you have a history of mental health disease or if you're below a certain age. So teenagers and adolescents should avoid it. But there are appropriate applications, and I think just from a safety perspective, we know that opioids are much more addictive than marijuana, that there's potential for accidental overdose and death, and that you don't see that with marijuana. And I feel much more comfortable recommending it for appropriate patients once they understand the pros and cons of the two options.
Do you believe that the leagues should not test for marijuana because of this?
Well, I think it's an interesting question. Look, I think screening for drug use is reasonable, but we should use those screening measures more to identify at-risk players. So if someone has a history of substance abuse, instead of punishing them, I think it makes more sense to treat them, to provide them, treatment for addiction and things like that. But if you're going to punish someone for using a drug responsibly, I don't think that part makes sense. So I don't think it makes sense to really do random screens and to punish people for using medical marijuana, especially if they're using it in place of a more harmful drug.
All right, then the medical marijuana aside, should we as a sports consumer care about a player winding down by smoking a joint?
I don't personally think that's an issue. I mean, I think we should care about the health and well-being of these players. Sure, we appreciate watching them on the field, but there's real repercussions of playing in these leagues, and a lot of players are coming to realize that they're either drinking alcohol or using opioids excessively to deal with pain. And that's oftentimes affecting their performance. And a number of professional athletes who I've spoken to about this topic have told me that, at the end of the day, they just need to get to sleep so they can wake up early in the morning and get to their workouts and practice. And I think we'll all benefit from, their health and their well-being because, we want to see them out there on the field and performing.
All right. Well, maybe the education will get to the leagues, the chieftains, and we can get through this problem. We appreciate you calling in, Dr. Ari. Thanks a lot.
Yeah, thanks for having me.
All right, there he is.